Now with the discovery of new variants of the coronavirus in some countries, including here in Nigeria, there is the increased need for citizens to take responsibility of protecting themselves by strictly abiding to COVID-19 safety protocols. And the job is no longer for health professionals alone, seen as also the numbers are also dwindling, with the Nigerian Medical Association saying it lost at least 20 doctors to complications arising from COVID-19 in the last 1 week, which was also what was described in that report we put together earlier that we showed you. And joining us to discuss about this in the studio is Mojisola Ayorinde. She's also a member Infectious Control Africa Network. Good morning. Thank you for joining us this morning.
Thank you very much for bringing me here.
All right. Let's quickly look at the issues surrounding COVID-19. Reports are saying that the death toll around COVID-19 has doubled in the last 1 month. And just in 1 week, which was last week, we had 20 doctors who have died as a result of complications arising from COVID-19. And in June, we also saw that we lost about 16 doctors. Health workers on the front lines seems to be badly hit by this pandemic. As disturbing as it is, we'd like to hear your concerns with regards to these figures that we're getting.
Thank you very much for that question. I'd like to say that the rate of infection of the healthcare workers that the coronavirus pandemic has hit is so much all over the world. It's not only in Nigeria.
Absolutely.
Yeah. So a lot of people have died. And our concern is, you should know that if an index case, only one person comes to healthcare facility, it can infect thousands of people because we are the touch, where they sit down, moving not around, going to get their drugs. Everywhere they touch is infectious. And most often time, before we carry out the test, we don't know that this person is infectious because some other people are asymptomatic.
So you were at the front lines during the Ebola period. Yes. You saw how Nigeria handled that case. You saw how Nigeria was leading from the front with regards to this week, because Nigeria was commended for its effort and at its approach at addressing these issues. And then the question on the lips of many is if Nigeria has learned lessons from that incident, because if it could lead from the front and also ensure the safety of the health workers, why are we not seeing that replicated at this time?
Yeah. Now, we cannot say that the government has not done their part, because we have what to use, and also for the organization that I represent presently on this coronavirus, the African Center for Disease Control has always been in support with other partners. And now, the challenge we can have is that we don't really have soldiers, responders, volunteers to work. We had to call out for healthcare workers to come and join us when the pandemic came to Nigeria. Apparently, infectious disease nurses and doctors are very minute in the response. But training has been going on, which we started ever since in March. And up to this December, we are still carrying out training of all healthcare workers, which were not available before. During the Ebola pandemic that we were saying to West Africa, I'm part of the people that worked in Nigeria at that time. We really have so much support. And there are a lot of people were coming up for their testing, even now and then. So Nigeria was commendable during the Ebola because we had to go to other countries to help them. But this time, all over the world is in charge of the pandemic. So we wouldn't say we need to leave our domain and start going to respond to other countries. But I like to say that so far so good, our rates of healthcare workers being infected with coronavirus is very minute compared to other nations.
But doesn't that raise concern? Because when you look at the number of health workers available in side by side, when you place it side by side, the population of 200 million, which a lot of persons say it's not enough. And now we are recording deaths. If we have to look at the data available, it's about over 30 health workers, doctors have died.
Like, I like to say that there's no how you go to a war front that won't be a casualty. Even if the person is well guarded, you should know that there will be a casualty. And I like to say that I thank my colleagues, healthcare workers, starting from the nurses, doctors, the cleaner, the hygienists, the maid. They are really doing wonderfully well. Everybody put their hands on guard, and we're really doing the job. Like, we cannot, like I told you, you cannot go to a war for that wouldn't get a casualty, even if you are going to win the war.
Right.
Thank you.
All right, let's look at asking Nigerians to take responsibility with regards to COVID-19, because there are talks that perhaps there is a new strain in the country. I would like for you to touch on that, the fact that it seems to be spreading faster than what we witnessed in the first wave, and how it is important for Nigerians to perhaps take responsibility, which the government has been harping on over time.
Yes. The coronavirus, it's 7 strain. And then, since the session in February 27, the strain has not been different. So now that we are discovering this strain, it's still the same approach to treatment. And the healthcare workers, the doctors, everyone, nurses, are really doing their best. And it's not only concerned to Nigeria, to other countries too. We have such a new strain.
And so in taking responsibility, what do you think are the gaps that we need to perhaps bridge at this point? Because the government has been talking about Nigerians taking responsibility. What more should be done? What more should be put in place?
Yes, what I would like to stress upon and to say that like infectious disease experts, for nurses, doctors, the training, the school, it's not really on ground in Nigeria, and then most people don't even know there are trainings for that.
Right.
Yes, and I like to also add that it should be part of school curriculum.
Beginning from now, moving forward.
Yes.
But in the short term, what should be done? Because that seems to be in the longer term.
For the short term, Nigeria has been very good in that, because we have been training and retraining. Even Lagos State has tried. Before by March, we started the training. Like Ilut, where I work, 50 healthcare workers were trained for over 7,000. I can virtually boast here that all the healthcare workers in Ilut are trained. All. Both record officer, the cleaners, because there was an infection prevention committee on training. And presently, this month, December, I can give you the statistics that what we have trained in Lagos State is over 7,000, because every week we've been training, even during the Christmas time.
But the
I'm part of the training.
Okay. But the NMA president is still saying that they are putting together a report to ensure that there is more with regards to the training for infection prevention, especially on the path of health workers. Now, let's quickly look at taking responsibility, which is something that I really need for you to talk about, especially with regards to the people now. Hand washing and all of that. I want you to lay emphasis, because you are at the forefront. You see, those who are infected, and you know what it is. Would like for you to speak from that point of view for people because there are those who still do not believe that COVID-19 exists. They still think that it's a myth.
Yes, a lot of people still believe there is no COVID-19. They don't understand it, and we should know their background. Knowledge is power.
Absolutely.
Yeah. So, in that regard, I will say that we continue to do the online message, the social mobilization that we are. Lagos State has been, when you listen to the radio, on the television, all stations talks about the COVID-19 and the responsibility each individual need to take. And for the healthcare workers, everyone has been trained. Like, that's what I can say. In the Lagos COVID response team, everybody has been trained, and retraining is still going on. And then we have our own responsibility to do also as healthcare workers, or even the people in the community. Because in the community, you go around, you need to do your hand hygiene. Is that you use soap and water, or you use alcohol-based. And the moment you do that, your hands are safe. Like I can always give my experience when each time I train, that for the virulence that we know that Ebola is more infectious than COVID-19. February 14, 2015, when I was in Liberia, a lady wanted to fall down. And I weighed the consequence, so I held her. And immediately I reported that I have touched her. I was self-isolated. And I washed my hand immediately. I'm still here. And in this response also, I've come in contact with several patients. And if you don't lower our guard, like I always tell my colleagues, make sure you wash your hand, you do your hand sanitizing, using the alcohol-based rub very well. There are steps to take so that you will not miss out any of the part of your hands. And then you wear your protective covering. And also you wear your mask at all times. The moment you are more than two, if you are not alone, you wear your mask because it's a droplet infection. Droplet infection comes and it cannot travel far. It can only go 5 meters. You cannot even up to 5 meters. So 2 meters you are done. So you have to protect yourself as a healthcare worker.
Very, very important. But one key concern for a majority of Nigerians is the aspect of data, where we do not have that data to really work with, as a lot of concerns saying that if you do not have the data, how are we going to really address this and ensure that we flatten the curve as soon as possible?
We really have a good data because there are some other people, we have 10 pillars in the response.
Right.
Some people are for contact tracing, surveillance, under surveillance and epidemiology. You have people that are doing contact tracing. For those people, if someone is infected, they collect the data, the address, the phone number, and they trace. Where African Center for Disease Control are even employed more than 60 healthcare workers in Lagos State to do that.
Really?
Yeah. That's what we do presently. So we have our good data. The surveillance are really doing their job. And I give kudos to Dr. Busola. She's really doing that.
All right, we'll leave the conversation here now. Mojisola Ayorinde.